So let's talk opportunities and threats. So I think we're really at a turning point here in terms of where AI in healthcare is headed. On the one hand, I think this is very much a threat to the current sort of way that healthcare operates. We have early adopters who are moving heavily into the AI space, and we don't know how that will impact sort of their businesses. You could easily imagine a world where those early adopters are able to outpace their peers in cost and efficiency, and we see sort of growing gaps in capabilities and in revenues across the market. You could also imagine a world where AI solutions exacerbate some existing issues in healthcare, something like health inequities, reinforcing some of those health inequities, perhaps making them even worse. On the other hand, I think we really are looking at an existential opportunity here. There are some really difficult challenges to solve. There are challenges that have been around for decades at this point in healthcare that we haven't really moved the needle on, that I think AI does offer the opportunity to move the needle on, around patient care, patient flow, clinician burnout, recruitment. AI solutions, I think, offer an opportunity here to actually make a difference. And so with that in mind, I think it's really a question of how do organizations move forward to sort of capture that existential opportunity while avoiding some of the potential threats. I mentioned some of the potential consequences of moving on AI, that rich get richer, the unequal progress, the existing challenges and inequities. I think the one other thing I want to call out right away is that I think we're still waiting to see sort of how does this change sort of healthcare dynamics broadly in terms of sort of the power levers that organizations have. If you think about organizations that have access and own a lot of patient data and a lot of the health AI models, how can that power structure potentially change based on the use of those tools? It's an open question. I don't have any answers to it yet. It's something that advisory board will be monitoring over the next few years of what really is changing in terms of impact and patient care from some of these sort of life sciences organizations, for example, just as one example. But with that, want to move into opportunities and perhaps probably my favorite slide in the entire deck. So this is a slide that just highlights you have the patient care journey down the left side of the slide and some areas where AI is potentially already or in the future going to be help solve problems. I'm not going to talk through each one. We could be here a while if I was going to go through each of these. But a few that I like to highlight, detection and screening. I talked about sort of the radiology in my background there. I think imaging interpretation is fairly widespread, at least in terms of AI technologies at this point, in terms of helping radiologists out in that space. But that is not the only way that you could see AI sort of get involved in the detection. We've seen studies recently showing that some of these GPT technologies can accurately detect Alzheimer's from speech and text patterns. A wholly different way to think about detection, right? Not using a medical image, but just using data that is naturally sort of created every day in terms of text messages that are sent or audio recordings to be able to detect healthcare problems. Another example is visit documentation, ambient listening, and transcription, nuanced stacks. We have a case study on that coming up on the next slide. But I think it's a great example of another sort of widespread use case that we're starting to see really change sort of clinician relationships to AI.